Bismillahirrahmanirrahim. In the name of Allah, who is the most beneficial and the most merciful. Honorable guests and my dear students, Assalamu alaikum. I am your moderator, Aayzah Naveed from Hamdard Public School, Karachi. Dear participants, on behalf of Hamdard Foundation Pakistan and Hamdard Public School, Karachi, I heartily welcome you all to the 31st International Children's Health Conference 2023. Before we begin our program, I would like to share with you names of the personalities who are with us today. Mrs. Sadia Rashid, President Hamdard Foundation Pakistan, President of the conference, Dr. Sara Salman, WHO Sub-Office Sindh, our chief guest, Dr. Aayzah Naveed, Minister for Health and Government of Sindh, guest of honor, Dr. Javed Akram, Minister of Health, Government of Punjab, and Dr. Jamshed Ahmed, Head of WHO Office, Punjab. Dr. Khalid Naseem, Administrator, Hamdard Public School, Karachi. We begin our formal proceedings of the conference with the name of Almighty Allah. I would request Shehdullah Khan of Hamdard Village School to please recite a few verses from the Holy Qur'an. Recitation be followed by its translation.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم والضحى والليل إذا سجى ما ودعك ربك قلى وللآخرة خير لك من الأولى ولسوف يعطيك ربك فترضى ألم يجدك يتيما فآوى ووجدك ضالا فهدى ووجدك عائلا فأغنى وأما اليتيم فلا تقهر وأما السائل فلا تنهر وأما بنعمة ربك فحدث. Translation. By the morning brightness and by the night when it covers with darkness, your Lord has not taken leave of you, O Muhammad, nor has he detested you, and the hereafter is better for you than the first life, and your Lord is going to give you, will be satisfied. Did he not find you an orphan and give you refuge? And he found you lost and guided you, and he found you poor and made you self-sufficient. So as for the orphan, do not oppress him, and as for the petitioner, do not repel him, but as for the favor of your Lord, report it.
Jazakallah Shehdullah. Honorable guests and my dear students, today we are celebrating World Health Day. On 7th April 1948, an organization was founded under the umbrella of the United Nations and was named as the World Health Organization, WHO. From its inception at the First Assembly of UN 1948 and since taking effect in 1950, the celebration has aimed to create awareness and work on international health, specifically to sensitize, prioritize, and focus on important aspects of health. Each year, a theme is selected by the WHO for the World Health Day. This year, World Health Day will focus on the theme Health for All, which targets that health is a fundamental human right, and WHO is committed to not only ensuring that everyone, everywhere, can realize the right to good health, but also ensuring the highest level of health for all also. It is important to note that the pandemic has transformed this conference into a digital event. However, we are not facing rigid lockdown, but due to Ramadan in April this year, and the participants around the world with different time zones, we are continuing live streaming event. Today, we have students from all over Pakistan as well as overseas to discuss the right to good health. Dear delegates, I would now request Mrs. Sadia Rashid, President Hamdard Foundation Pakistan, for greeting and opening remarks.
Bismillahirrahmanirrahim. Honorable Chief Guest, Dr. Azra Fazal Chiho, Minister for Health and Population Welfare, Government of Sindh. Honorable Guest of Honor, Dr. Jamshed Ahmed, Head of WHO Office Punjab. Honorable President of the Conference, Dr. Sarah Salman Zubairi, Head of WHO Sub-Office Sindh. Distinguished guests and my dear young friends, Assalamu alaikum. Greetings on this very important year and the figure 75 in 1948, the health branch of the United Nations, the World Health Organization, came into being. Interestingly, so did Hamdard Pakistan. And even more exciting a coincidence is that the nation Pakistan, established in August 1947, in April 2023 is living in its 75th year. Marvelous milestones for all three. Don't you agree? The Hamdard International Children's Health Conference, which has now become a tradition, was first organized by Hamdard Pakistan's founder Hakim Muhammad Said. It became an annual affair, a legacy we have kept very much alive. And isn't it delightful that it coincides with all these special anniversaries? Before we go any further, I would request you to raise your hands and join me in a few moments of silent prayer for our brothers and sisters who are suffering from the tragic devastation wreaked by recent earthquake in Turkey, Syria. Amen. The theme of this year's World Health Day is very naturally the very goal of WHO Health for All. And of course, the very basic things needed in order to even hope to reach this desired end are access to safe drinking water, adequate food, shelter, hygienic conditions, and healthcare facilities. Basic they may be, but none of these things can an individual easily provide for himself or herself. The community and the state must both take part in fulfilling their responsibilities. Experience has taught us that the most effective way of providing these necessities is for the state and community to establish and keep running a primary healthcare system. Without this universal health coverage, in other words, health for all, does not have any hope of being achieved. Without this, the financial burden on individuals would be unbearable. No one should have to face a choice between healthcare and starvation. That is not just wrong, but obscene, and a blot on the face of all in charge of the state and community. Many private individuals have organized and are running free health facilities. May Allah bless them. But nothing can replace an official healthcare infrastructure, not just buildings and machines, but trained personnel and proper and free or subsidized training for them. And the establishment of institutions is not enough. There must be maintenance and quality controlled administration. In addition to these facilities, what can never be ignored is at least basic education in order that the population can differentiate between the safe and the harmful, the unhealthy and the healthy. And to aid the population and keep the system running, there is a need for a sizable health worker force from the highest to the lowest level, for no level is unimportant, and each plays its part: the doctor, the nurse, the midwife, the ward boy, the cleaner. It is imperative also to have sufficient public funds to establish and keep running this infrastructure, not forgetting the totally essential plugging of holes through which, alas, some corrupt individuals can siphon off some of these funds. Perhaps this is the most challenging and difficult of tasks, but not impossible, as proved by examples around the world. Where there's a will, there's a way. May Allah guide us to finding it. Ameen.
Thank you, ma'am, for your speech. We have received a message from World Health Organization from Dr. Tedros Adhanom Ghebreyesus, the Director General WHO. Now I would like to play it.
President Sadia Rashid, distinguished guests, dear colleagues and friends. This year marks the WHO's 75th anniversary. As we look back on our history, we have many achievements to celebrate, especially for children's health. In the past 30 years alone, the number of children who die before their 5th birthday has halved, thanks to major improvements in newborn care, immunization, nutrition, and more. But far too many children still die from preventable causes, including 400,000 in Pakistan alone every year. Each death is one too many. We have much more work to do. I'm delighted that children and adolescents are participating in this conference. Your voices must be heard to help find solutions and shape a better tomorrow. 75 years ago, the nations of the world came together to affirm that health is a basic human right. Thank you all for your continuing commitment to realizing that right for children and adolescents. WHO remains committed to working with you toward a more healthy, peaceful, and sustainable future for the children of Pakistan and the whole world. I thank you.
Thank you. Health is our most basic human right and one of the most important indicators of sustainable development. The policy Health for All, adopted by the world community in May 1998, aims to realize the vision of Health for All, a vision born in the World Health Assembly in 1977 and launched at the Alma-Ata Conference in 1978. Dear delegates, it is our humble request to you all to please abide by following instructions. Keep your mic muted unless you are asked to speak. Your camera should be open throughout the conference. Please speak slowly and clearly so that the viewers are able to understand what you are saying. Your cooperation will be appreciated. Our first speaker, Serish Asher, is from the host school, Hamdard Public School, Karachi. Along with Hamdard Foundation Pakistan, has been hosting this conference for the last 30 years. Hamdard Public School is located at Madinatul Hikmah, City of Education, Science and Culture, which is situated at the outskirts of Karachi, some 40 kilometers away from the city center. Madinatul Hikmah is the name of an endeavor for the revival of those values and traditional efforts in education, science and research, which are our cultural bequests. Its objectives are outlined by the founder, Shahid Hakim Muhammad Saeed. Serish, kindly share your views with us.
Respected President of the Conference, Honorable Chief Guest, President Hamdard Foundation Pakistan, ladies and gentlemen, and my fellow students, Assalamu alaikum. I, Serish Asher, am here to share my words with you all on this year's topic, Health for All, designated by World Health Organization, marking the 75th anniversary of the World Health Organization. Honorable President, as stated by Buddha, health is the greatest gift, contentment the greatest wealth, faithfulness the best relationship. Honorable delegates, health is a complex object for science and operative levels, partly because there are many approaches defining it, but not so scientifically sufficient and operatively accepted. Determinants of health, as a widely accepted theoretical proposal, identifies as problematic the reductionist view of health as the disease opposite. Attempting to develop it positively according to WHO's definition, proposing a set of factors determining health outcomes. Respected Chief Guests, it's a matter of fact that whenever mankind is granted something without them hustling for it, they take it for granted and neglect it until that thing is withdrawn from their lives. In the words of Thomas Fuller, health is not valued till sickness comes. Honorable audience, however, we are the blessed citizens. We are blessed with numerous facility of hospitals, clinics, laboratories, etc., along with hygienic food and sanitation. But what about the rural population? People in developing countries usually have a lower life expectancy than people in developed countries, reflecting both lower income levels and poorer public health. The burden of infectious diseases, maternal mortality, infant mortality, and child mortality are typically substantially higher in those countries. This is how living in a developing country comes with sacrifices. But health shouldn't be one of them. Sacrificing lives for one's nation is another topic for debate. The loss of health of innocent newborn and vulnerable elderly will not help a country in any way. Rather, a child who's not embraced by his village will burn it down to feel its home. Considering the previously mentioned obstacles, Hamdard Foundation Pakistan has introduced health card facility for its employees. Similar facilities should be adopted by other private organizations to make healthcare services more sophisticated and easy to avail. Dear delegates, health is not a restrained right. Comparatively, it's inclusive. It's a universal right implemented on everyone, whether it be a man or a woman, old or young, rich or poor. They all are entitled to require the government to provide it to them. However, according to the WHO, 30% of the global population isn't able to access essential health services. Respected Chief Guest, government play a major role in healthcare financing by mobilizing necessary resources to public budget. Their contributive mechanisms, pooling resources allocated to health development, guiding the process of resource allocation, and purchasing health services from various providers. Develop a plan for increasing political commitment to safely manage drinking water, sanitation, and hygiene, including outreach to leaders at all levels of government and engaging with civil society groups. Develop a strategy for strengthening governance and institutions required to deliver these services, such as by establishing autonomous regulatory agencies that enforce health-based standards and regularly publish findings. Nevertheless, the grass isn't always greener on the other side. The urban population might be quite qualified and facilitated to understand such matters, but mental health have always been an elephant in the room. It's an enormous obstacle that needs to be resolved, but have always been ignored or laughed off, even by the knowledgeable. Dear audience, as stated by World Health Organization, mental health is more than the absence of mental disorders. It exists on a complex continuum, which is experienced differently from one person to another, with varying degrees of difficulty and distress, and potentially very different social and clinical outcomes. This is a basic human right and should be provided to all because health is for all. I would like to end my speech on a positive note and a quote by Martin Luther King Jr. For he who has health has hope, and for he who has hope has everything. Thank you.